I'm Tom Burgoyne. Yeah, there's no reason why you should know who I am. I'm on the Bradford Hill organising committee, and I'd like to welcome you to today's talk. I'm delighted to say that we'll be entertained, I dare say, by Professor Danny Dorling. First, a little bit about the Bradford Hill Seminar series. So it's the principal joint seminar series of the Cambridge Population Health Sciences Partnership, which comprises the Departments of Public Health and Primary Care, MRC Biostatistics, and the Epidemiology Unit. A special welcome if you're on the MPhil in Population Health Sciences. I will potentially see you on the social epi module in the coming year. Lost my notes. There we go. Now, I suspect Danny needs no introduction, but I'm going to give him a little bit of an introduction because it feels like a courtesy. Danny works at the University of Oxford, and he's the 1971 Professor of Geography. He studied for his PhD in Newcastle before moving on through Bristol, Leeds, and Sheffield, and ending back up in Oxford, where he was born, as I understand it. He'd like you to tell me that in his spare time he builds sandcastles. I understand they are architectural masterpieces. I did some digging of my own whilst researching the intro, and I stopped counting at 20 monograph entries on the university website. But Danny tells me that he is stuck on his idea for his 60th book. So this is a man who is not short of big ideas. When I think of Danny, I think of big ideas. So hoping to hear some of Danny's big ideas today. If you've never heard of World Mapper, or if you've heard of World Mapper, Danny was one of the team who originated that back in 2006. So maybe a challenging title, The Politics of Epidemiology and Public Health in the UK. Danny's agreed to leave plenty of time for questions, so we should have 20 minutes to get thinking. And if you're joining us online, please turn off your video, but do leave your questions. I don't know who I'm talking to. I think I'm talking to this laptop. Do leave your questions in the Q&A box, and we'll try and get to those and not miss them. Thank you very much for joining us here today, and take it away.
Thank you. Thanks ever so much for the invite. Tom's in charge of the timings. He's got to tell me when we've gone past half an hour, because there is no clock in the room. I have too many words and too many slides. That they are there for people who get agitated. So they're going to go so quickly, you won't be able to get to the bottom of the words, but they're a comfort blanket for me. Beginning, we like to think of ourselves as kind of value-free, proper scientists and so on. We don't tend to think of how much what we do in the politics of our times. But we are in an extremely skewed political country. It can have no effect on us. And of course, we come from particular social groups on average. It has all kinds of influences. There are a lot of very simple questions I think need answering, one of which is at the bottom, why do we not even know whether our children are getting shorter or taller in England at the moment? Really simple questions. I'm going to go through a number of topics, mainly because I'm going to feel guilty I don't touch on them, and then slow down at the end. So if we can go forward a slide, that works. Public health and the politics of fear. Mo Stewart is a brilliant disability campaigner, and these next few slides come from her and her work. And about what's been happening in recent years. If anybody recalls, they can look back and get web references and Citizens Network reference. About the disabled being going to pay at the moment. We have a kind of war on the ill at the moment. I'm going to show you some quotes from the Conservative Party conference. I think it was about a week ago. And what was said then. There's a kind of bizarre side to this, in that you'll know that the Conservative Party tends to draw its support from very old people. They're quite likely to end up being disabled or already be disabled. You wouldn't think this would be a vote winner, but apparently they do. Let's click forward again. I told you I'm going to go through them quickly. Here's a quote from the Shadow Secretary, Work and State and Work and Pensions. Millions getting themselves sick notes from the GPs, how terrible they are, sick society, this kind of thing. I can see people wanting to read it. Our welfare system should be a safety net, not a lifestyle choice. That's the environment, political environment we live in. That's the news environment we live in. We have tens, if not hundreds of thousands of researchers in universities working on health, working on often very particular, very useful things. And we have a mass attack on people who are very ill in the country at the same time. And that kind of thing, I'd say, is only possible when you have a politics of fear. When you have a worry, I want to be able to keep my funding, I want to be able to keep my job, I want to be able to look at my particular genetic study or the disease I'm looking at or the screening program I'm interested in. The fact that I'm doing this under a situation in which our politicians are attacking the ill in a way, that's somebody else's problem. Hopefully for the past readers, you've got to the bottom of that. This is the letter that Mo written to the Secretary of State that I think was published yesterday. It's about how terrible it is to dismiss anxiety as an issue. This idea of we're in a world of feeble youngsters who can't work out what they're doing and old folk who are feigning their incapacity to do stuff. It's just not helpful, and it's very, very political. And I question the question, is it really going to get votes at one point, given people's own experiences in most of their families, unless you decide that the illness in your own family and amongst your children or your cousins is a special, genuine kind of illness, but there are other people who are not. And I don't think that will work. There was a similar thing which did work in the 80s, which was to tell people that the unemployed were work shy. And that could work, particularly in the south of England, because most people didn't know somebody was unemployed in the south of England. And so the Conservatives increased their vote share and won in 79, 83, 87, and actually remarkably in 92. But I don't think it can work with something like mental illness, illness in general, and so on, because I can't believe there is a family of any size out there in the UK for whom you do not know, if it is not yourself, somebody who is suffering some of the conditions that Kemi Badenoch walked down. I do wonder one day whether, let's go forward, poor old Kemi will be ill. I wonder about, what she said about other people's anxiety. Oh, there's been brilliant investigative research by Compassion in Politics into how many MPs have suicidal thoughts. If you may have seen the document, or heard the documentary in the last year on that. Mobility cards are not awarded depending on diagnosis, and so on. The number of things said in the politicians' speeches that were just demonstratedly untrue, but don't get picked up again. Last slide, I think, if we go forward from this little series. Oh no, lots of references. Let's go forward. That's useless just for learning people to go back. Office of Budget Responsibility. The amount we spend on Social Security is 11.1% for the next 5 years, lower than it was in 2015. Right, there is no ballooning benefits ball. In fact, as I'll show you later with my favourite slightly complicated graph, we spend less than any significant other large European country or even medium European country on public benefits, on public goods, on health, on welfare, and so on. We talk more about a ballooning benefits bill than any other country in Europe, as far as I can see, and we have less of a ballooning benefits bill, not because we don't have people that are ill, because we give the least money. Let's go forward again, and hopefully we'll begin to get away from slides too much work. I'm going to talk about 2 pieces of research I was involved in. I did that because mental health is the biggest thing and I don't do much on it, so that's why I'm there. Britain's Golden Cohort. Those born between 1925 and 1934, who had better improvements in health than the cohort born before them and the cohort who came after them. So this is a really interesting cohort. There's a kind of idea, were they born particularly resilient? Was there something special about them? There's been papers on, they're almost all dead now, 1925 to 1934. Lou Heim and I, and Lou might be watching online from the States, Lou Heim and I looked in detail there and wrote a paper that's 10,000 words long. And the second paper was done with Lou and Martin McKee, where Lou did most of the work of interviewing public health experts about why they thought what they thought. Because there is not a unanimity of views in public health in Britain about what's going on over some key issues. The key issue we were interested in here was austerity since 2010. And life expectancy peaking. Let's go forward again, because I might have a complicated graph at one point, which needs to stay up for a bit longer. Not yet, although that's going to come. Life expectancy for both men and women hit a maximum in 2014, as released by ONS, slightly accidentally. They released a single years figure. They like to release 3-year rolling average, but they released a single years figure to 1 decimal point. 2015, 16, 17, and 18 were all lower. It wasn't that there was a particular coincidences of cold winter around the right size. 2014 really was the maximum. In 2012, women over 65, their life expectancy began to fall. This is 3 years after the beginnings of Osborne's extreme austerity. This kind of thing is unheard about. But the arguments in public health were, oh, it's just that the benefits of statins have now all been realized. I'm paraphrasing, but it's not really due to the cuts. And you can't prove it's to the cuts. So why are you saying it's the cuts? It's going to be very complicated what's actually happening. It doesn't matter. Right to the other side, left-wing side, this is literally verging on social murder. You have to read the paper if you want to know, but incredible lack of agreement, I would say, actually in the top of public health in Britain. We're all very polite to each other. You know, we're kind of mostly English. We hate embarrassment, but big disagreements about the most significant national change in life expectancy since the 1930s. Right. And we have all these experts, all these people fully medically trained, all these people with masters and PhDs, people who've done incredibly complicated training, writing so many papers in hard journals to look at. And yet at the top, there is less of a consensus than you might expect. This quote is from political controversy. I wrote a series of pieces for the conversation in the year 2020. The year 2020, almost we can step back from the trauma and think this feels bad to say this, but what an interesting natural experiment to carry out on epidemiology and public health. A little bit like you might remember the Queen asking the Economist after 2008, why didn't any of you see it coming? The banking crash, and why didn't you know what to do? Very similarly, internationally, with the COVID-19 pandemic, there was a high level of disagreement amongst public health experts. There was an alternative independent committee set up. There were calls for zero COVID, for locking down forever, for being like New Zealand. There were other calls for opening up the schools at the rate that Denmark did after a few weeks. There probably are still people not talking to each other. I'm very fortunate because I am a geographer. Okay? This is a blessing being a geographer. I have no medical qualification at all. I have no expertise. It doesn't matter what I say, and I'm a bit careful about how I say it because I'm not a medic. This is a quote from Professor Epidemiology at Yale to do with the 1968 flu. 1968 was really our last big flu. 1889 Russian flu, maybe another disease. Another flu pandemic at some point that nobody really knows in the 30s, which is fascinating. Oh, sorry, big 1918-19. 1957 flu, 1968, it was serious. In that my father has only been ill twice in his life. Once was to cut an ulcer out of his stomach in a day. This is the doctor, so it had to be done quickly because he had to get back to work. That's a GP. And the other was a week in bed in 1968 with that. And then 1977, small flu, maybe Russian lab one. And then H1N1 so small that really they are pretty tiny. But what do you do in the event of a flu pandemic? And what you do is you shut down and you flatten the curve because it goes up in 5 weeks and goes down in 5 weeks. And if you can flatten the curve, you can at least cope and you don't do that. What did we do? We disagreed with each other. We were very lucky to get the vaccine that early in hindsight. But absolute belief on some sides that really there should be no contact at all. And it was fine for the children month after month, almost year after year, not to mix. The inquiry, I think, is underway now. It's gone through 2 weeks of evidence on what we've done to the children. We'll be able to compare across European countries long term to see this, to actually get an idea. And in future, people will write theses looking back at what it was that the various public health experts said. And then how some of them say they didn't say that, but it's on the record over what we should do. I don't think I've got much more on COVID because I'll probably upset you, but I'm very happy to talk about that because it was the moment for epidemiology, which was the equivalent of the banking crisis. Go forward again. And I think we now have a picture for that. So, autumn of 2020, when we weren't letting the university students back. In hindsight, would it have been better to let the university students back and send the students into schools and for them to actually have got it in then so that when they saw their grandparents, which many would have done on Christmas, they would have immunity in hindsight? And why didn't we know? And to what extent is it politics? At its most bitter, I'm always wary of saying this, but at its most bitter, some experts accused others of bias because their children were attending private schools and getting 9 to 5 instruction on the computer screen. State schools often just completely fell apart. I can't help thinking that there might be nothing worse than 9 a.m. to 5 p.m. online lessons by a teacher really, really dedicated to making sure they kept their job and the parents didn't pull them out of private school. What's the point of sending them to private school? Or politically, why on earth did we bail out all the private hospitals? We didn't nationalise them. Anyway, just in 2020, we bailed them out. What was the thinking behind that? Let's go forward. I'll show you one graph about COVID, produced by a geographer, just to say this is the proportional deaths where COVID-19 was mentioned. I think these are probably local authority districts. And in the places with the highest proportion of COVID in wave 1, which was kind of Brent and London and so on, a bit Manchester, the numbers testing positive by the 1st of August were minimal. Because there was what we now know was temporary immunity, okay? Not herd immunity, not immunity forever, not immunity that you get from some things, but very low. Whereas the places where there had been very few deaths had higher proportions. So here. These are the places where there were very few deaths and very few tested positive at the start of wave 2, because it wasn't until wave 3 that COVID got there properly. COVID got everywhere in February of 2020 because we had a death marked as COVID in every single one of about 7,000 MSOAs. But so this is a remarkable country. It's essentially London and transport routes out. And one thing we can learn is the disease will spread very quickly in this country. This map, where did wave 2 start again? I quite like it because it was Slough. What's another name for Slough? If you guess, where you might fly your pupils in. No, it's near. You'd fly them into Heathrow, but where were they actually? It was Eton. And in fact, people who study past pandemics often use boarding school records. But wave 2 came back in through schools, but it was going to come anyway. It's just interesting where it came. Let's go forward again. Okay. This is looking about where experts disagree about what on earth was happening with life expectancy and mortality in general. All things simply like our infant mortality rate rising absolutely, which is of course not simple, right? You end up worrying about one breath of air, if you know this, and to what extent sympathetic midwives claim that they've seen the one breath of air from the baby, so it's a baby, not a stillborn, because you get higher benefits. And what kind of country? So if you want to know about trends in infant mortality, you've got to look at trends in stillbirth as well. You've got to worry about things like that. You've even got to worry about people being flown in because Great Ormond Street is good. You certainly mustn't do what I almost did once, which is publish a map showing the highest rate of infant mortality in a particular area of London. And then suddenly stop yourself when you realise, oh, they're dying after 6 months. and the parents have moved there because the kids are at Great Ormond Street, and it's very easy to make mistakes. I'm sure I have. But in the last decade, we have seen rising infant mortality. We've seen rising child mortality. We've seen rising child mortality under age 5. We get particular cases, such as the baby found dead next to his father who was dead, if you remember that case. And then we worried about that case slightly less when we've discovered it occurred in Skegness. But it's, but the numbers were rising. We have a public health disaster. If you look at it on a historical scale, or if you look at it at a geographical scale, our neonatal mortality rate, I think there are only about 5 or 6 countries in Europe where it's worse. And I won't name them because it's really unfair, because the minute I name them, it's a bit like Skegness. It kind of implies, oh, what do you mean our neonatal mortality rate's almost as bad as that place where Chitty Chitty Bang Bang was set? Right? There's no reason why poor Eastern European countries should. In fact, it's quite incredible that things are changing. I could say to try and make you feel positive, a graph I haven't got is the United Nations estimates of change in child poverty in the most recent 7 years. And it's a wonderful graph because 3/4 of countries have seen falls in child poverty. These are rich countries. Sometimes falls of 30%, 25% in just 7 years. I should have brought it and shown it you, but we imagine even the US over this period had falls. The end date isn't that recent. There were 4 countries which had increases in child poverty of 10%. From memory, they included Iceland and Norway, Switzerland, I think, forgotten the 4th. They were all countries with incredibly low rates of child poverty, but still a rise of 10%. But generally, the picture's generally good. The picture's across the European continent is good. The picture worldwide is good. The picture in the USA is very, very bad. And in that graph, the country that stands out by a mile is the only country to have had a 20% increase in child poverty in the most 7 years, which is the United Kingdom. And we managed to do that despite having falls in child poverty in Scotland. As you may not know, but Scotland has a special payment. All families are receiving benefits, which is 2 out of 7 with children now aged under 16, get about £30 a week. That's £4,000 a year, untapered, not restricted, £4,000 a year for a family of 3 in Scotland. You don't have to go hungry, you don't have to go cold, and you don't have to get shorter. The Scots release their child height data and you can see them getting taller. Why are we not bothered about these things? Yeah, possibly Rachel Reeves may finally lift the 2-child cap, depending on how many taxes she's going to introduce in the budget. Or she might save that as a kind of carrot for later. But what on earth are we playing with this? Let's go forward again. Okay, this is a complicated one. Golden cohort. This is a Lexus diagram. I'm going to assume half of you know what one of these is and half don't. Year of birth, age, an improvement over time in mortality, and the golden cohort is much more green than above it, okay? Except for the last 10 years, which were awful. And those last 10 years, which begin around the time of austerity, are pretty awful all the way down to there. But experts disagree about austerity. But you cut things and that happens. These are world wars, very bad for the young, First World War, Second World War, and so on. And a lot going on, but austerity was just there. This little graph is how we're falling down the ranks. In terms of international life expectancy in the 1950s, we were in the top 6. The 5 countries above us had a population combined of less than the UK. We were really spectacular. We had baby incubators. You know, we were actually at the top of the world with an NHS that worked. We also had some of the best social housing in the world. Majority of children, we only know because of the 1946 birth cohort, a majority, you check me for time. Majority of children in 1946 lived in the council house at some time, which is absolutely normal, incredible social housing program. And we introduced the most progressive education in state education in the 1960s, with the idea that it was really possible for children to just go to school with the other children near them. That was revolutionary. Other countries copied it. We're a long way away from that. It's all very political. In hindsight, it's easy to say these things were sensible and worked. No, but well, there are people in some think tanks who say we should still have the slums. They really are, but they're not many. Go forward, and I get to more recent work. I have to go over lots of topics because I'm still going to miss out. I've met a colleague there who's interested in road traffic accidents, so I'm not going to do that. Politics, what you may be worried about. This is really, really remarkable. These graphs, I hate these graphs normally. They're too easy to make. People always make them. But this is really easy. 2024 election study, how people voted. Instead, they voted. More people didn't vote than actually, people don't like saying I didn't vote, okay? That's 2024. This is the most recent data, which is early summer this year. This is just 1 year. This has never happened before in a year. We're volatile. Don't worry that anything could happen, but just be aware that you can't predict. Labour, which got fewer votes in 2024 than 2019, so actually got fewer, but still got 300 MPs or whatever, that managed to lose half its support in 12 months. Spectacular, unprecedented. It hasn't lost its support to Reform. It's lost its support to Don't Know and to minor parties mainly. The Reform loop is tiny. You don't go straight from voting for Starmer to going for Nigel. And in general, people don't do that. When Corbyn lost 2 million votes in 2019, the ones he'd had in 2017, I shouldn't personalise it, but shorthand, you know, for this, they went to not voting. Switch. What the press managed to do, if you really demonise somebody, you can convince 2 million people not to vote for them. With a measure. Lib Dems have managed to stay at the same level of support, but with huge turnover, despite doing spectacularly well in 2024. I won't talk about nationalist parties. Greens got a bit bigger. Interesting. They're unlikely to sweep the board, but not impossible. Unlike the Greens, I think are currently on 15%, Labour and Tories on 17%, Reform's on 34%. Right. It's not impossible that the Greens could rise 3,000 members in Bristol, and that's so unlikely that you end up with a Reform versus Green option in England. Much more likely you end up with Reform versus Plaid Cymru in Wales, would be the two main options. Very likely you end up with a Reform versus Labour option in England, partly because I think Labour really want that. If you wonder why do Labour ministers talk so nastily about migrants, they don't honestly really dislike migrants when they live in North London. Because if Reform are still there at the next election, and you lot are going to vote, and you have your nuanced idea that I quite like the Greens because they got a new leader, or you know, there's Liberals are okay, and your party. But you're aware that if you vote for what you actually want, rather than for the likely failed Labour government, you might get something that verges isn't, but verges on practice. It's a really silly game to play, I think, especially 3 years out. I think you should actually sensibly to try to do it more play. Reform, double in size in a year on the basis of having spectacularly destroyed the Conservative Party. Conservative Party is an all-time low in 2024, managed perfect, almost half in a year. We're all over the place. And that's a context in which you're trying to get on with work, do research, and so on. Lou Higham, who I mentioned earlier, just in case she's watching, I think she's already published 2 one-page articles in the BMJ and has a column. She's sitting in America. So she's writing about what's happening in the USA at the moment. If you want everyone to feel good about yourself, you just have to go there. Click forward again. I know this is serious, but you've got to be slightly light-hearted, especially when you put this up. We are not there yet. There is an ambiguous definition of what it is. We have to remember the 30s. These are 2 versions of a famous checklist. What did slightly amuse me is that on Amazon, which I know I shouldn't use because I'm supporting a tech bro billionaire, but when I look to try and buy my anti-fascist poster on Amazon, it says out of stock. We don't know when we're going to get it again. Yeah, there are times on our past we can learn from, but we do really need to be aware of what we may be teetering on the edge of right now. And if anything is going to affect health, it won't be some nice policy about soft drinks or, deciding to screen for prostate cancer, as good as that would be, or something else. It would be a majority of Reform MPs in the Houses of Parliament, and disbanding of the NHS, introduction of the American companies. If that were to happen, that's so much bigger than what you're working on. Possibly, you could disagree with me or not. Let's go forward again. Yeah. Why am I being so confident in apart from the fact I'm obviously a narcissistic and quite arrogant man, right? But why am I being so confident about being so forthright about it? This is one of the nicest graphs the FT has published in recent years by John Byrne Murdoch, talking about strange times. The FT now publishes things far to the left of the Guardian. Why does the Financial Times, which, if you're old enough to remember, used to be the paper of the city and didn't have particularly progressive views, because it's now the paper of record of Europe, and it sells lots of copies in Europe, and you're not going to sell copies on the mainland of Europe if you don't be at least slightly sensible. This is data from thousands of political scientists worldwide, placing all the political parties in the rich world and the medium countries on a left to right scale according to their economic policies. Right, these are middle of the road, slightly boring political sciences. At one extreme, you've got the Greek Communist Party and the Cuban Communist Party, and at the other extreme, this is someone in interest, you had the British Conservatives. Right, somebody has to be there. You always think you're normal. In 2014, Cameron took the Conservatives out of the European Conservative bloc and joined a group of Alternative for Deutschland, who are the biggest far-right group in Germany. Now looking like they're going to do well. Our Conservative Party became a far-right party. Our Reform and UKIP became a far-right party. There was another bloc they could join in Europe. Our Labour Party plays along with the US Democrats. It's kind of like Tory light. We're playing some games. Most of the Liberal, Social Democrat parties are just about here. Others over here. Here you've got AfD in Germany, Brotherhood of Italy. Economic policy. So if you think it is weird, that is because objectively, if you try to measure it, you are living in a weird time and in a weird place. But we adapt to feel it's normal, and it will affect our public health, and it will affect what we do research on. Let's click forward again.
5 minutes, Danny.
Brilliant. We're going to go fast. I wrote a book last year called Next Crisis. These last few slides come from that. This is wealth inequality falling, by the way. That's measured overall. Wealth inequality isn't as bad as it used to be, except for a few billionaires and multi-hundred millionaires. Right? The Sunday Times stopped publishing the 1,000 richest families a few years ago and only publishes the top 250. Because the ones below the top 250 aren't doing so well. It's politically, it's really interesting. At what point will most of the 1% realize it's not in their interest, forgetting about the 99%? Let's click forward again, because I'm really interested in what you have to say. Crises, I'm worried about crises. This is the use of the word crisis in the English language. I've looked at other ones. It starts in 1800, it ends crucially in 2019. You know it's going to zoom up. This is the 1960s. I was born in the 1960s, as Cuban Missile Crisis, but we've had poly crisis, permanent crisis for my entire lifetime. And we didn't have it as much before, even when we had pandemic after epidemic and cholera and typhoid and so on. Or wars, world wars. Yeah, that's 1930s fascism rising. Yeah, that. So you can take heart a bit. Don't think the last few years are exceptionally different. And it may be because we actually live in a time of peace and relative plenty that we do worry so much. Maybe. I'm an optimist about this, but the key thing is just data on that. Forward again. I've got about 6 left. Just to show I do my work. Health differences. This comes from the Atlantic magazine. If you're aged 20 to 30 to 40 to 50 and you're in the US, you're 4 times more likely to die in a year as compared to other rich countries. It's huge. It's not until you get to age 100 that you've got a 1% advantage of not dying that year. And basically, you're going to die if you're 100. What's it worth it? This is, or if you're in the top 1% in the US, you're going at 86, the same as the top 1% in England. You do worse than the top 1% in most other, almost all other, certainly Western European countries. It's kind of, this is really heartening because if the very, very rich did live longer and were healthier, it would make sense why they'd to do this. If spending so much on private healthcare actually helped. Life expectancy over time, the green line is the US, that's not how to deal with the pandemic. Over compared to us. Although India and Russia, 4-year life expectancy drop, which at least 3 years was not due to COVID, just everything falling apart. Go forward again. Too many slides, I'm sorry. Other serious things to think about, wars. Some very nice people in Sweden have been collecting data on how many people die in war since 1989. You can produce a world map of war deaths, warlike situations. I can't help thinking that as life expectancy plummeted in Russia during COVID, as maternal mortality, I think, went up threefold. It was kind of quite convenient to send the tanks into Kiev because nobody was asking about internal war. Put it very bluntly, if you look at that map, apart from Rwanda, you're basically, the word I always want to use is looking at a crusade, or the people who are dying are not living in the countries where the weapons have been made to kill them. Although the good news on war is until about 16 years ago, the number of deaths in war was going down. And it hasn't risen that high. And we really care about war. We see it and we hate it and we don't like it, and increasing numbers of us won't fight in it. And we campaign against it. Go forward again. But this is the big fear. Okay, this is a graph I promised you. Public spending. Public spending is a portion of GDP. In the 1980s, about 40%. It's now, it's at a 70-year high. It's almost the same as taxation, give or take borrowing. But it's lower than all these other countries. Two I've missed off are Switzerland and Ireland because their GDP figures are inflated by American companies in Ireland and Big Pharma. It's quite interesting to be talking here, surrounded by the biggest concentration of Big Pharma out of Switzerland. But anyway, that's austerity. That's bailing out banks. That's paying for COVID. That's furlough. This is where we're set. This is 2026. Because every government tells the IMF what it intends to do in future. And this gap is a couple of national health services. Or in all these countries, almost complete state education. Or not paying £9,000 a year to go to university. Or all these things that are entirely, completely politically impossible because we only have this much room in which we can maneuver politically. It's just a geographical comparison. Well, if you want to know what happens if you get to 65–60% public spending, well, you get Sweden in the past. It may not quite have worked. You know, we have data and historical examples. The only two countries which have spent less than us, and it's a long time ago when they did in Europe, were Greece, shortly after the generals were in charge, so not democratic, and Spain shortly after Franco. It takes an extreme, largely undemocratic country to spend so little on its public services. And that red line includes spending on the armed forces, which we spend a lot on. Go forward. I'm missing on your 5 minutes, so you must, and I think you can read these. This is why I'm so bullish. There's Stephanie Flanders Bloomberg, and there's John Byrne Murdoch. I've spent most of my career largely saying things were worse than people realized. And I don't have to say it anymore because other people are saying it. And nobody in public meetings in the last 5 or 10 years has got up and told me the country's doing brilliantly. And it's very sad, but we used to have to argue about that. Go forward again. And this is the underlying thing that matters for health, is your levels of poverty. So, what people worry about in the world in a particular order, you may not realize. Although, and thanks to some social scientists in particular, the largest worry in the world is inequality, poverty, cost of living. But even if you take cost of living out, inequality and poverty was number one. The second largest worry is unemployment, which has shocked me, and I felt really bad and privileged. Most school children are worried about whether they're ever going to get a job or be needed. You work in universities, you're worried about what's going to happen. We're the privileged. And then crime, violence, war and home, and then healthcare. It changes by country. The biggest difference is China, where the biggest concern is healthcare. Old population, slightly worried about how you get into a hospital. And if you want a sign of success, if your population is worrying about that and not about other things, despite the huge inequality in China. Well, climate crisis is down at 5. This is my last slide. Yeah, climate crisis is down at number 5 and sinking. Because other concerns worry. And when you have those concerns, and when they're actually genuine, it is worth worrying. And you could say, we've sent a majority of people to university now. Maybe in the past, when you just went to the mill and you could hardly read and write, you didn't know and life was easier. And you could look at the mental health of young Americans in the 50s and see how much better it was than now. But we certainly live in a time of huge anxiety. Quite a lot is fairly justified. The book I'm working on very, very badly, if anybody's doing a PhD, I've got your sympathy, because I was supposed to have finished it in September and I've got 2 crap chapters done. It's trying to understand why people are having fewer and fewer children everywhere, and there's no sign of that stopping, and it's accelerating. Even in the most liberal bits of Nordic countries where they shell out nurseries on you and you've got equality of pay and the men do the housework and generally actually do and don't lie, it's still 1.3 children per couple. And the conclusion I'm coming to is it's because people are aware of the outside world. It's not that they're selfish. It's certainly not that they can't afford to have children, because it's people with the most money who are not having them. It's the concern about the planet into which they might be having children. I think, very hard to prove. So it's depressing. The last slide is supposed to be uplifting. I could do more being uplifting. I could have spent half an hour going through amazing things that have happened in most places. Or amazing things in the UK. But I quite like this because I'm obviously a lefty. But this was seen as seditious 100 years ago. There was a thing called the Socialist Sunday School movement. If you wanted your children to go away on a Saturday or Sunday out of the house, if you didn't want to send them to Sunday school, you might send them to one of these. There's still one in Glasgow, I think. And this is their 10 commandments. And you look at them now, and they just seem bland and quite reasonable. Nobody would be going, well, that should be a prescribed organisation. Yeah. It's over time, we are slowly and badly trying to work out how to live with each other and be nice. We're not making a very great job of it at the moment. But I don't think it's worth despairing too much, because most of the solutions tend to be quite similar over time, which is this kind of thing. And most of the solutions, when suggested, are said to be impossible. And then within years of them coming in, I'll simply recognise, well, of course, that's what you do. Thank you for putting up with me and letting me veer away from medicine and public health. I would love it if medicine and public health moved back more to what I can remember it being in the 80s and 90s, before the human genome was fully sequenced. And you lot went off on a wild goose chase to individually work out stuff. I'm sure it's very valuable. But in terms of millions of lives saved and millions of years, it's not the big win. That's the key thing I want to say. Thank you very, very much.
We have 10 minutes for questions, and Oliver wants to live stream it. So thank you.
Sorry. You say you're a lefty, and it's actually it's really good that you wear your politics on your sleeve, and you're very clear about that. The problem we know about politics is that an ideology is it tends to become a bit of a morality play, and people think they're the good guys, and then also beliefs cluster in a way that is non-logical in ideological positions. So what I'm trying to work out is, are you asking for more politics in public health, less politics in public health, or more of your kind of public health?
I'm asking for more. Don't be so shy about it. But our political parties have always been very tightly clustered together. So although I'm a lefty, I'm probably at the point that Macmillan was in the 50s. Or the most revolutionary people in terms of public health was a liberal lord called Beveridge, a Tory Minister of Health who helped usher in the National Health Service. It wasn't just Labour. So, and my favourite, the MP for Oxford, who was Lord Hailsham later, Hogg, who in the February of 1943 spoke in favour of the welfare state in the House of Commons. This is a far-right Tory in 1943. Spoke in favour of the welfare state and because it was a redistribution of wealth, and that redistribution of wealth was needed. So it's really silly to think if there are times when our politicians are all progressive and there are other times when actually they're all quite similar and not that progressive. The question is, what are the circumstances that led us to be in the current situation that we're in? So we got the most advanced housing in the world, copied worldwide, and we got the best health service in the world, and we got the most interesting education, barring our legacy one that we never got rid of. Because all our politicians decided or became more radical. And it may have been because their fathers took them into 2 world wars. And at that point, you know, you begin to doubt the wisdom of the aged. But you want to try and move the whole thing. So if you're really brave and you want to be really useful, join the Conservative Party, play in it, and just move it back towards the kind of nice one nation conservatism that all those MPs that were sat by Boris believed in, or John Major, brilliant Prime Minister, inequality fell. Yeah, that in a way is more good than being a do-gooder in Labour.
Well, Michelle, we're going online for the next one.
Yeah, got a question from Mark Pilling here. It's about voting. Any research on likely changes to current voting projections due to 1, boundary changes, and 2, enfranchising 16-year-olds?
I haven't seen them. Doesn't mean they weren't. And there used to be so much work. And I felt one of the books I did a tiny bit of work on was with Ron Johnson, Charles Patty. And the title was called From Votes to Seats. And we wrote a whole book on boundary changes, which really will send you to sleep. But so boundary changes used to really matter, like they get you 10 or 20 seats and there's gerrymandering. Things are so completely up in the air now. I don't think there's any worry about them at all because the other factors are so big. Every time it's been a long time since we enfranchised a new group. The last one was women under 30 in Northern Ireland, I think in the 60s, were allowed to vote. Every time you let a new group in, you think it's going to change things. They're slightly disappointing. And so I don't think 16, 17 will have a huge difference, despite the fact that when we polled them, our people under 24, we find that they have very what I call progressive views, especially the women, especially the women. And it's across Europe. They're for green and for left politics. And the number of men who aren't is pretty tiny. We obsessed by the small number of young men who are not.
Sorry, this isn't about your research, but like, did the Financial Times quantify how they measured sort of what counts as how right and how left wing?
Yeah. So it's an international survey of political scientists that belong to political scientists, bodies of political scientists, and a huge panel where they're asked about all political parties to say how they think they are on a series of scales. And the biggest number of these are sitting in the USA. So it was done as kind of fairly as possible. But there isn't an alternative one. It was done at the time when Truss had just, was there. And, I suppose the political scientists saw what the money markets were saying, but also you got to remember, this Truss sacked the senior civil servants and took the young men, almost all men from Tufton Street, those few, and put them in government to be with her for 49 days. So they finally got their chance. And they were told kind of where to go with that. But it's as good as you could have done. I'm trying to think how else you can. It is normal to think where you are is normal. But you know that Cambridge is. I'm from Oxford. we compete with you because we always want to claim that we're the most unequal city in the UK. Annoyingly, you've been winning it recently. But you live or work or travel into and across the most unequal city in the most unequal country in Europe, give or take Bulgaria, at the most unequal time since the 1930s. Think of an Inspector Calls, you know, and books like that written about. You're living in effect in a time of servants. It's just that they're cycling, delivering, cut price. But this is your normality, but it's not normal internationally.
We mentioned about why people are having fewer children, and I apologize, it's kind of the last point in your talk. Do you think that people's concerns about lack of welfare support in their old age was perhaps driving higher rates of childbirth than people would choose to have voluntarily, because bringing up children is quite difficult? If they've got that support available from the wider society around them, then they feel less obligation. I need to have 3 children to make sure that somebody's going to be looking after me when I'm 80.
Yeah, I don't think people look that far. One reason to have 3 children or 4 children, but our servant keeping classes lost 1 in 10 of their babies just over a century ago. Children just used to die. So actually to have somebody in childhood. The reason why I don't think people think that far ahead is that if they did, and it should come by now, and it ought to come soon, the average age of having children across Europe and the UK is about 31 now. It keeps on rising. It's rising linearly. There isn't even a curve. It's not even, and you're waiting for it because there's obvious reason it can't, you know, get much above mid-40s, early 40s. If people thought that much about their old age, why are we not yet seeing women picking men who are younger than them? You know, why on earth are you wanting to set yourselves up for the last 10 years of your life on average looking after a dodly and frail and rather useless old man? Put it bluntly, and I can't find that anywhere, and I'm looking for it because one of the things that might increase births would be younger, on average. Most partnerships are male, female. Younger men who actually did do more of the housework because they're more progressive and actually changed the napkin and did that. But if we don't think that far ahead, our behaviours will be so, in general, we are quite impetuous over relationships, but we're very, very, very good at not having children. Most effective, and we also put people in situations where the most effective contraception is just being sent to university. It's.
We're rapidly running out of time. I'm going to go to someone new, if that's okay. Whichever one of you guys says something first to ask.
I was curious about your point about bringing politics more into public health, in terms of political mandate on what we record. Like you're talking full of numbers, data, but that's only there because you're allowed to record it. What if the politics today says you can't?
So
you're privileged now to be able to give us this talk. Certain movements that would deny you even access to that data. Where does that sit in your?
Oh, this is huge. If I can get
lack of independence.
Yeah, if I can get my memory right on this one. Labour used to love social statistics, particularly Harold Wilson, who appointed Klaus Moser to be the Registrar General. The 1971 census is the best by far. It's huge. Asked whether you've got hot running water. It's actually used for planning. When Thatcher came into office, she cut 25% of what were then OPCS, now ONS staff. Got rid of them. In 2010, the Cabinet Secretary's assistant came to see me at a conference. I was in London, because they were planning on cutting the census in 2011. Because the right hate planning. And the best way to get rid of planning is to get rid of any data you can use to plan.
That's why getting rid of child poverty.
Yeah, it goes. The fascinating thing, or what saved the 2011 census, was that the order forms were being scanned by a company called Lockheed Martin Mission Critical Systems. If you know your arms dealers, like Lockheed Martin make weapons. But on the side, they will scan census forms because they're interested in information. right? And luckily, they're clever arms folk. I'll be careful because this has been recorded, and they get the contracts right. So the escape clauses to not hold a 2011 census would have been more expensive than holding it. So we still got a census. We got a sort of census in 2021. Very quietly, so I shouldn't say this, it's been agreed that there will be a old-fashioned census in 2031. Right? Because people who want to plan. And something really weird about this country, I was telling you positive things about this country. We collect more data than anywhere else. You know, we are obsessed. We had a COVID surveillance survey. You know, Madrid did it once. But for the world, the reason we know it does this and the waves is that we actually had 100,000 people being constantly monitored who volunteered for disease. You know, we are incredibly lucky. We kind of turned, I think, our expertise or need to surveil so many other countries in the world that we'd invaded, 90% of the current members of the UN, into ourselves. And part of it has actually been quite useful. You might worry now about, I forget the name of the firm who's been given NHS data and so on, but at least we have NHS data. There are states in the States where you just can't get death records. Yeah, so it's a good news story. But if you really want to stop people thinking in the way I do, you just take away the information, and you don't fund WHO.
We need to draw to a close just because people have probably got places to go and are worried about sneaking out. If you still get your hand up, come down to the front and we can just do that one-on-one. But should we thank Danny again for his time?